TAVR is a new therapy for the treatment of patients who suffer from a particular heart valve disorder called aortic stenosis. Your heart has 4 valves that regulate the blood flow between the different chambers. The heart valve that controls the blood flow between the main pumping chamber and the big blood vessel is called the aortic valve. Sometimes as you get older, the aortic valve can become stiff, it can develop deposits of calcium, and all of that impairs the exit of blood flow from the heart. Unfortunately, there's no medicine that can treat this condition. The only option for patients up to now has been traditional open heart surgery to replace the heart valve. TAVR allows us to replace the aortic valve with a much less invasive procedure and a much quicker recovery.
We can come in one of 2 approaches. The most common in the early way was we would insert the catheter through an artery in the groin, and then we would travel up into the heart. Some patients, however, can't have that procedure because of the size of their blood vessels, and so in those situations we can actually make a small surgical incision just under their left breast, and we can go in that direction.
And this is one of our first patients, Mr. Milton Hall. He's a 89-year-old gentleman who had a gastrointestinal bleed and had an ultrasound, and during the ultrasound they found that he had an aortic aneurysm. And what was decided with the multidisciplinary team that would be the safest and the easiest on Mr. Hall was to do a TAVR procedure on his aortic valve, followed in the operating room by a stent graft of his aneurysm, and all that was accomplished in one setting. And then Mr. Hall was taken to the recovery room and left 2 days later.
I'm grateful that I was here and they were here, and this all worked out at a critical time, because all I had left was just to decline, and that was it. So now I've had nothing but a little better health all the way from the day I got up. The next day after this type operation, I was up walking around on the floor here at the hospital, and then the next morning I was discharged and went home.